Inclusion Healthcare is a social enterprise. Our background is in homelessness and general practice, and we launched our social enterprise in 2010 to look after the needs of homeless people and vulnerable groups in Leicester. We were delighted to be awarded an outstanding overall rating with outstanding in all the key areas, which was a fantastic achievement for the team.
Tears of joy, because I was so proud, because I just felt that it wasn't just about inclusion, it was about the fact that we actually help vulnerable people.
Across the team, we all value our clients. You know, we want them to have what we take for granted. A lot of the clients have bad experiences of trying to access services or thinking that they're treated second best.
If I had to go to another one, I'd feel embarrassed, and then to look at my legs, they wouldn't look at me as the same way as, you know, this inclusion look at me.
Patient safety is always at the forefront of what we're trying to do.
We always look at making sure that the environment is safe, so it's following the infection control, which is very important, that things are clean and tidy and calibrated and up to date.
They generally or frequently present with immediate healthcare needs.
It tends to be about malnutrition, they're not looking after their chronic health conditions, especially the diabetes and obstructive airways disease, asthma.
Our aim is to try and address the crisis, but also have a long-term plan to keep them coming back so that we can successfully, address their healthcare. Some
of the ways we do that are by creating environments where people feel safe and welcomed, so that they can come and spend time telling us about how we can help them.
We have an understanding of the situation clients can be in, patients can be in, and we can offer a little bit more flexibility in terms of attending appointments.
They'll go out of the way to help you. They'll go that one bit further to help you.
I think one of the things we're most proud of that helped to get the outstanding classification was our ability to learn from significant events and learning events. And that's something we've developed over a number of years within the culture. We have a very simple significant event reporting process, a single side of A4, and then every week those significant events are looked at by a complex patient group.
It will then be fed back as a team level, it will be fed back as an individual level. So it's always a matter of reflecting back, looking what we could have done differently.
But the most important thing is that people are not afraid. When something goes wrong, they can talk about it and they can bring it up with their line manager, say, I wish I'd done this differently, or this happened, could we change that process? And very quickly we were able to change things and improve services.
It's brilliant what they're doing, it is.
Everybody needs to be inspected by CQC. It's important to maintain our standards and to make sure that we, not just nurses, but doctors, admin, everybody reflects on their practice.
I think it's positive pressure. We feel confident in what we deliver. But you still want to make sure that is projected out to other people, don't you?
It's not just me, I'm talking like hundreds of people what come here do appreciate this service.
They are what drive us in terms of where we want to go and what we want to do. We have a vision, but it's led in part by them and what they feel fits.
We need to have professionals who have an understanding of this client group. That's what's important about inclusion.
As a result of being able to say that we are an outstanding practice, we've had the confidence to look outside the practice again and see where else we might extend the offer that we give to other practices within the city. And we've recently bid for and won the right to caretake another practice which is serving vulnerable groups in the city. And we're helping to build that practice up from perhaps what wasn't an outstanding level and try and take some of our culture and our values across to that group of patients and improve that practice care.